Welcome to the Stay Healthy El Paso podcast, where we help El Pasoans get away from taking pain medications, avoid getting injections, avoid surgery, and keeping up an active lifestyle. This podcast is presented to you by Dr. David Midoff, expert physical therapist and owner of El Paso Manual Physical Therapy. It is our goal and intentions to provide you with valuable tips and insights from experts in the El Paso area so you too can stay healthy, fit, and energized. Now here's your host, Dr. David.
Hey El Paso, this is Dr. David Midoff, specialist physical therapist over at El Paso Manual Physical Therapy, and I'm your host of the Stay Healthy El Paso podcast. Today we're going to talk about misdiagnosed plantar fasciitis, and specifically how to figure out your heel pain, because if you really don't have plantar fasciitis, then what the heck is it? What's going on? And how do we figure this out so that you can get back to being normal, get back to being active, healthy, and mobile in your foot and ankle without having to rely on pain medications, injections, and of course, dreaded surgery. So let's get into some specifics about how plantar fasciitis is typically diagnosed, what healthcare professionals are looking for as far as symptoms, signs that are classified or diagnosed as plantar fasciitis, and then what kind of treatment options are out there. And I'm going to get into the controversial stuff, the misdiagnosis and how what we look at here in the clinic at El Paso Manual Physical Therapy, and how we find misdiagnosed plantar fasciitis almost every time we see a plantar fasciitis patient, somebody that comes in saying they got plantar fasciitis. So let's get into it. So first off, the biggest symptoms that people have whenever they go see their physician or their foot doctor or whoever it is they're seeing that's a healthcare professional for their heel pain, when doctors, physicians, foot specialists diagnose plantar fasciitis, the number one sign they're looking for is when you get up in the morning, your first few steps, if you've got sharp stabbing pain in the heel that kind of gets better as you walk around more, but maybe never goes away, or maybe it does if it's not that severe. But the classic telltale sign is that sharp stabbing pain with your first few steps in the morning. That is often called plantar fasciitis. Now, there may be some associated limping that goes on, like you can't walk normal. You have to walk very, very carefully, hold on to furniture, or hold on to things as you get up. And then some people report swelling as well. They get swelling around the heel area. They get a different sensation at the bottom of their foot on the heel side of their foot. And some people perceive it as swelling. The last patient we had in here with these kinds of symptoms said that she felt like the pad at the bottom of her heel was flat, like it lost its air, as if to make it like a tire in a car. Like she said, she feels like I have a flat tire and I'm stepping on the bone instead of the cushion, the meat of the foot under the heel. So that's kind of the description people have. And, it can get better and worse without ever really knowing or understanding how it happens. And as far as treatment, once, you tell a physician that you've got this, and then they're going to automatically start writing down plantar fasciitis. Treatment, there's tons of different ways to go with this. Of course, physical therapy is one of the treatments. I'll talk more about that later, but let's talk about other treatment options that people go towards if they've got plantar fasciitis. The simplest, easiest one that people do is ice. They start icing their heel. They'll just get a bag of ice or some sort of cold thing that you can buy at the store, those gel packs. The other thing that's commonly done is they'll get a water bottle that they freeze. So it's like a cylinder shaped ice block essentially, and they'll roll on it on their heel and the arch of their foot. And that can be quite beneficial, actually. The reason for that is because it kind of numbs the tissues, all this, everything under the foot, and can be relieving. The problem with it is it doesn't solve the root problem, which I'll get into more about what the root problem is, but let's just go through these treatment options. The next one is braces. People often try all kinds of braces, the ones that you lace up, the ones that have struts, metal struts or hard plastic struts on the sides. There's braces that you just wear at night. Those are called night splints. So you may not use anything during the day, but there's special plantar fasciitis braces that you wear at night. And the reason why they're special is because they've typically got this fabric strap that hangs off the end of the toes that is attached to the shin area of the brace. So it holds your foot and toes up, like you're lifting your toes up, and it puts a stretch on the bottom of the foot into the heel. And some people report they feel a little bit of relief with that. Another more invasive treatment option is injections. Injections are commonly done for plantar fasciitis symptoms, specifically cortisone or corticosteroid injections, because that drug is an anti-inflammatory and pain reliever. So the thought is that the plantar fascia, which is a tissue, I'll go more into it in a second, that it's inflamed, and so if we inject anti-inflammatory medication, then it would help with the pain and with the long-term outcome. The problem is that the plantar fascia is made of connective tissue, and corticosteroids are known to degenerate connective tissue with prolonged use. So it's very much a short-term solution. And then in extreme examples, you can have surgery. There are plantar fascia release surgeries where a surgeon will go in there and cut the plantar fascia to relieve pressure. Now, I'm not 100% sure on exactly how this is done, as far as if they cut the entire plantar fascia or a portion of it. This isn't a common surgery, so it's not something that I know a lot about because we just rarely see it. I've seen it in 2 people before, and where they cut it based on the scar, it looks like it's only a partial cut, not a complete cut of the plantar fascia. So I think that's how they're doing it, is they just cut an edge of it to kind of lengthen it a bit just to relieve some pressure, but they won't cut it the whole way, is my hunch anyway. As far as the way I think about the body mechanically, I doubt that a surgeon would completely cut the plantar fascia in most cases where they're looking to do surgery on the plantar fascia. Okay, so we're going to get into the PT treatment discussion about what is done in physical therapy for plantar fasciitis. But real quick, let's visit what plantar fasciitis is physiologically. What's going on in the body, so that listeners out there can understand how this all works. Now, let's start off with the plantar fascia itself. The plantar fascia is connective tissue that attaches from the heel of the foot. And if you want a visual of this, it's easy to just Google plantar fascia. Google will probably autocorrect you if you have trouble spelling fascia, because it is a little difficult to spell. And click on the images tab, and you'll see tons of pictures of plantar fascia. It's all over the internet. Anyways, it's a white tissue, a connective tissue. It's white because it has a low blood supply, and its job is to help maintain the arches of the foot. There's actually 3 arches in the foot. The main one that everybody talks about is the medial longitudinal arch, but there's a lateral longitudinal arch and a transverse arch. But its job is to primarily help hold up the medial and the lateral longitudinal arch. And so the theory, and I say theory because this is not proven, this is how most healthcare professionals are operating. The theory is that plantar fasciitis develops because it's getting overly stretched out. So if you have flat arches, it's tensioning the plantar fascia. And if you do that too much, then it begins to irritate the plantar fascia at the insertion point at the heel. And that's why it's tender at the heel. And that's why people get these symptoms when they first stand up. It hurts a lot right in the heel. And so that's why the treatment options are such. That's why they do the surgical, the plantar fasciitis releases. That's why the braces, the idea is that it's too short, it needs to get stretched out. The injections as well at the heel. That's the thought process with normal plantar fasciitis. But what most healthcare professionals don't think about, that I need you to be aware of, is that the plantar fascia is not the only structure in the heel, which means it's not the only thing that can cause pain or discomfort or some problem. You've also got a pretty substantial fat pad under the heel, There's bones there. The calcaneus is the heel bone. And there's tendons that pass in the area. Tendons are what connect muscles to bones. So they help to transfer forces to pull on things and make them move. And then the biggest culprit of heel pain, in my opinion, is nerves. Our nerves cover our entire body, and specifically in the heel, there's several nerve branches that cover the heel. And there's one that runs right over the insertion point of the plantar fascia. So when I do my testing, when I have a plantar fasciitis patient here in the clinic, one of the first things I do is do something called a windlass test. And I do a modified version of it. I'm looking to put some tension on the plantar fascia, and then I have to poke on it. And now what we'll do is we'll poke on it without tension and poke on it with tension. And the idea here is that if it is truly plantar fasciitis, if it is the plantar fascia that is affected, when we put tension on it, because it's connective tissue, it's designed to maintain some tension to hold certain body parts together, in this case, the arch of the foot. It stresses the tissue a bit. And then if we apply pressure on it, that stresses the tissue a bit more. So it should theoretically hurt most at the plantar fascia if we apply tension to it and put pressure on it with the finger. Versus if we take tension off, we put it on slack and then apply pressure, it should hurt less. Consistently, when I get a patient with plantar fasciitis, I do this test, this windlass test, modified windlass test, and it is negative. In other words, it shows that the plantar fascia is not the culprit. And then I'll cross-reference this test with a nerve test where we feel and tension and affect the nerves that run into the heel. And those tests become positive. So I have to make the call, the diagnosis with the patient that the heel pain is not plantar fascia driven, it's nerve driven. Now this changes everything, because if it's truly plantar fascia driven, then the treatment's going to look different. Now we have to ask the question of if it's a nerve problem, do we need to be stretching? Do we need to be splinting it? Do we need to be bracing it? Is our injections going to help? Is doing a plantar fascia release surgery going to be effective for a nerve problem in the heel? And I always ask the question of, did the doctor that diagnosed you with this plantar fasciitis do these tests? And it's always no, because they just aren't aware. It's just not something that they're trained to do or have figured out to do. And I don't expect it of other healthcare professionals. This is kind of our profession as a manual physical therapist. So it's our specialty. But we can figure out if it's truly more nerve or more plantar fascia or something else. There's issues in the joints of the foot that can also contribute to heel pain. And we look at that. And then there's also a situation where you can have a combination of things. So we have to judge that scenario as well, and then make the proper treatment recommendations for the patient moving forward. But what we'll settle on here is about 9 times out of 10, when we get a plantar fasciitis diagnosis here in the clinic, a patient's coming in saying, I saw a doctor, they told me I have plantar fasciitis, I Googled the symptoms, and all over the internet it says heel pain and limping and swelling are symptoms. So Dr. Google's confirmed for me, and a real doctor's confirmed for me, and I have the paper here from the doctor saying that I have a plantar fasciitis syndrome. Then I'm thinking to myself, I'm gonna take this with a grain of salt. I'm gonna check it for sure, but let's check the nerves too and other things so that we can know exactly how to treat this. Now, if it's plantar fasciitis, if it's true plantar fasciitis, physical therapy treatment is usually focused on improving the arch, which makes sense because you want to take pressure off of the plantar fascia using muscles and other structures in the foot to alleviate the pressure on the plantar fascia. But if it's not plantar fasciitis, and if it's a nerve problem, and we're we're doing a treatment that's treating plantar fasciitis to better support the arch, we're going to miss the boat. And people can have the experience, the situation where they go through physical therapy, do all the foot and ankle and toe exercises. They typically will do heel raises, like calf raises is the name for it, where they're tippy toeing. They might do it in different ways. Maybe seated to do a light version of it, standing to do a harder version of it, with weights to do an even harder version of it, on a foam pad to add a balance aspect to it, single-legged. They'll do ankle stretches where they stand against a wall and push their heel back and put a stretch to the Achilles and the foot and the heel. They'll do toe exercises as well. A common one is where they have to scrunch up a towel with their toes or pick up marbles with the toes. Or I've seen some people have to pick up pens or other objects with their toes, and it always makes people feel like a monkey because they're having to use their toes like fingers. And it can help to alleviate some of the symptoms, even if it's a nerve-driven problem, simply because we're just getting more motion to the foot and the heel, motions that haven't been done before. But to truly fix the problem for the long term so that it's not coming back in 3 months or 6 months or a year, we've got to look at the entire length of the nerves that end up in the heel. And typically it's sciatic nerves. So one of the questions, here's the misdiagnosis that I'm talking about. One of the questions that I have to ask every patient whenever they come in with heel pain is, do you believe you have, or do you have minor amounts of sciatica or low back pain? Because the nerve that ends up in the heel that is commonly affected, it's a branch off the plantar nerve, which is a branch off the tibial nerve, which is a branch off the sciatic nerve, which starts up in the back. So I have to ask, do you have pain in your butt area, your thigh, your calf? Do you have any cramping that occurs in the calf and the thigh, up in the hip? Do you have any achiness? Have you had any back problems? Or maybe it's not really painful now, but in the past, have you had issues? I'm also looking at the way their back moves, any other muscle imbalances that might be further up the chain. And I'm putting all this together to formulate the best diagnosis, which will then lead us to the best treatment. And time again, it happens. We find an issue. We find some sort of back pain. Usually the heel pain is so intense and so limiting that our patients often forget that they have back pain. It's not something that they're worried about. And if they're on pain medication for the heel, that lower level sciatica pain or back pain kind of diminishes, and they just don't even think about it. They're completely focused on getting rid of the heel pain, that they just don't pay attention to the back or thigh pain that they've been having. But I have to dig there. And then I'll do some nerve tests. And once we do those nerve tests that are biased and tensioning nerves into the heel, if those tests are positive, if they create some sort of symptoms, then it's absolutely a nerve-driven problem. And then the treatment for that is completely different. We're doing some foot stuff, some foot exercises, some foot hands-on treatments, but I have to look at the knee, we have to look at the hip, the thigh, and the lower back. And oftentimes we're doing treatment on the low back, hips, and knees, in addition to the foot. And that's what truly clears up the heel pain. I won't even call it plantar fasciitis at that point. So the last client that we had with this, she came in, she's been having heel pain for a while. She is an active individual. She's in her 60s, late 60s, I believe. Loves to do housework, gardening work. She takes care of her elderly mom, who's gone through some health conditions. She is active and wants to. She's a grandmother and is trying to spend time with her family. She's not really a couch potato, and she's been doing that for a long time. She helps out her husband with a business, and is on her feet quite a bit for that. So this active individual all of a sudden was put down by this heel pain, and she just kind of muscles through it, but has to grit through pain and discomfort all the time. And the biggest problem she had was when her mother was at her sickest. She's gotten better, thankfully. Her mother was waking up at night often, and our patient would have to get up to go check on her at night often, and it would just kill her. It would hurt her heels so much to have to take those first few steps at 1 a.m. and then at 3 a.m. again and at 5 a.m. again. And so it was just so painful and aggravating. And when you're in that much pain and that much discomfort, you just don't want to get up. You lose focus. You aren't thinking clearly. You want to take medications. You're grumpy. It's just a bad situation. What she found is that wearing shoes helped. It didn't completely take away the pain. Wearing shoes that had a little bit of a heel helped. It also didn't take away the pain though. And she tried doing normal physical therapy. She tried doing ice. She hadn't done injections or surgery yet, thankfully. She had tried braces and splints, and it all kind of helped, but didn't really solve the problem. So that's why she ended up visiting us. And when she saw us, she was convinced it was plantar fasciitis. The doctor told her it was plantar fasciitis, and she's Googled it. It was plantar fasciitis. She has all the symptoms. And when I looked at everything on her, I found that she had a significant back condition that is going to put pressure on nerves and can mask a plantar fasciitis symptom, but it really is a nerve symptom. So as we've gone through treatment for a nerve symptom, not plantar fasciitis, she's done phenomenal. Her getting up in the middle of the night is less of a problem. Getting up in the morning isn't a big deal. Now where she's at, we're about a little over a month in. She is really only getting pain or discomfort after she's been on her feet after a long day, which is a great place to be because now it's just a matter of getting stronger in certain muscles. In her specifically, the biggest weakness that she's got wasn't in the foot, it wasn't in the lower leg, and anywhere near the heel. It was her abdominals. By strengthening her abdominals, what I determined is that we can take pressure off of her back, because that's where she's getting the most pressure on the nerve. So by strengthening her abdominals properly and having her use them throughout the day properly, that alleviates pressure in her back, which untensions the nerves beginning at the roots in her back, which then will allow more nerve freedom all the way down into the heel. So far we've been successful, and I know she's going to do fantastic as she continues to strengthen. And then doing her busy, active lifestyle, gardening, taking care of the house, taking care of family members won't be a thing for her. It won't stop her, this heel pain. So that's how plantar fasciitis is often misdiagnosed. It's just taken for word from the healthcare professionals that if it's heel pain, if it hurts in the mornings especially, if there's some limping or swelling going on, then it is plantar fasciitis. But it's not dug into more than that simply because most doctors, physicians, foot specialists just are not specialists at looking at the nerve aspect of this. And if you're out there, you've got heel pain and you've tried the braces, the splints, you've tried taking over-the-counter pain medication, maybe even prescription strength pain medication, or worse yet, you've had injections, or maybe even a plantar fasciitis release surgery, and you still have the problem, it's still there, I'm willing to bet that you've probably got a nerve problem that hasn't been addressed, and you've been misdiagnosed, unfortunately, with plantar fasciitis, when really you've got what I call a neuralgia, a nerve pain. That's what that means. So no amount of orthotics or insoles will fix this problem either. It'll help. Don't get me wrong. I'm not against orthotics or braces or splints. It will help, but I'm talking about long-term resolution of this problem. We've got to address the nerve symptoms, and we've got to look all the way up the chain of joints and muscles. And oftentimes it ends up being in the back and the hips. So that's our podcast episode for today. I hope you learned a lot. If you've got plantar fasciitis symptoms, heel pain, and you suspect that this problem might need a deeper look into it, you can definitely reach out to us here at El Paso Manual Physical Therapy, and we're happy to talk to you about it to see what could be done about it, if it can be helped, if we're the right people to help you for that. We can begin that conversation. You can find us at epmanualphysicaltherapy.com or give us a call at 915-503-1314, and we're happy to hear about your heel pain story, and we want to learn more about it and see if we can help out. I hope you have the best day ever today. Bye-bye.
Thank you so much for listening to the Stay Healthy El Paso podcast, brought to you by El Paso Manual Physical Therapy, where we help El Pasoans get away from taking pain medications, avoid getting injections, avoid surgery, and keeping up an active lifestyle. If you'd like to learn more about what El Paso Manual Physical Therapy can do for you, call 915-503-1314 or visit our website at epmanualphysicaltherapy.com. Mention this podcast for a free discovery visit valued at $100. If you enjoyed what you've heard, please be sure to leave a review on iTunes and follow the show on your favorite listening platform so you won't miss an upcoming episode. Tune in next time to get the best health tips from experts in the El Paso area.